So there's this term that we call age-related testosterone deficiency or age-related hypogonadism, and the idea is that we call it that when we don't know what's causing it. And it's this funny term because it sounds like it's just something that happens naturally with aging. And we have this inclination to think that if it happens naturally, maybe we shouldn't even treat it. Maybe it doesn't deserve treatment. But you want to know something. First of all, aging is no fun, right? Aging is associated with blood vessel problems, heart trouble, diabetes. Any medical condition you can think of is age-related, except for pediatric stuff. So, and we treat all of them if they're affecting health. So it wouldn't be so bad if it was just age-related. But the problem with testosterone is that you could have, in theory, age-related testosterone deficiency in a 25-year-old. Just because you don't know what the cause is doesn't mean that you shouldn't treat it. With high blood pressure, 80% of people with high blood pressure have what we call essential high blood pressure. It means we don't know what's causing it, but we treat it because it matters to the person. And the same is true with testosterone. If somebody has symptoms or signs that are associated with low testosterone, I think they should be treated. Overall, testosterone is really, in my opinion, remarkably safe. We can never say anything is 100% safe. People can get sick from drinking too much water. They can drive their sodium down. They can get really sick. But by and large, testosterone is really quite safe. As a matter of fact, every human being on this planet, male or female, has testosterone in their system. Like our bodies have seen it. And when we treat it, it's the same molecule. It may start with a little side group chemically, but that all gets cut off. And the circulating testosterone that actually is doing the job is testosterone. It's identical to the testosterone we make in our bodies. And so my point is that the body's already seen this stuff. It doesn't mean that it's safe at any particular dose, but it's seen it. Whereas if you take an antibiotic or a statin or almost any other medication, the body is not familiar with that molecule. But everybody is familiar with testosterone. So one other issue that comes up is about treating men who are older. Like maybe we shouldn't, maybe they're more susceptible to something or other. But testosterone levels decline as men get older, and some of them have a lot of symptoms. So it doesn't bother me to treat somebody who's 80, and I even have treated men in their early 90s.